Yeah, welcome. My name is Dr. Tushar Deoras, and I'm the Chairman Managing Director of Astute Academy. And today we are going to cover a very important topic, that is a medical post graduation. As you know, the plain MBBS has no value. Now everybody has to do the specialization, and now it has gone to super specialization level where you are not just an orthopedic surgeon, but you are a spinal expert or you are a shoulder replacement or a knee replacement expert. So now the whole medical fraternity is changing, and the rate of change is very fast. 25 years back, nobody thought knee replacement operations, and now we are doing the heart replacement operations. We have the chemotherapy given to the patients, and there is no vomiting sensation to the patient. So a lot of new drugs are coming, new technology is coming, engineering, medical is merging together. After 10 years, 20 years, 25 years, something new will come. And that is why the doctor's journey, you have to constantly learn, and you need to get a latest education which is really of global standard, and that is what I'm going to talk about it. So I'll be briefing you about the Indian admissions also and the international. What are the options, different options in a medical post graduation, and what are the really great strategies you can make. I'm also USMLE examination strategists and residency exam expert. We have been doing it many years. So to become a great doctor is important. Okay, wherever you are doing the education, you should go to the best of the medical colleges. And when you're doing the really a good college MBBS, always it has been a post graduation, and National Medical Commission, which is the Indian government, recognizes the five countries other than India, that is the US, UK, Australia, New Zealand, and Canada. So if you do the medical post graduation in any of these five countries, you can come back to India, and from the day one you can start practicing it. So if you are done gynecology, you can come back to India and practice gynecology. If you are done the any surgical branches, you can come back and do the surgical branches. No questions asked. Day one, no examinations, nothing. So these five countries are exempted. Other than these five countries, in any country go, there are a lot of things. Non-English speaking country, definitely you cannot come back. But in some of the English speaking countries, there is a very stringent process. But these are the five countries which are in the pyramid. And we have been working in this field for almost now 30 years. I was also scientist at Bhabha Atomic Research Center. And we have very big research team here in India as well as in United States. Now, we also has affiliation with the Residency Hospital, PA Hospital, where we know in and out of the admission process. And we always believe the quality education will lead to successful career. And that is a fundamental right of every student. That what does that mean? Even if you are not academically very great student, you may not, your percentage and everything may not be great, but still you deserve to get a post graduation degree. And that is where we really is working based on the profile of the students. What is the best possible way? In India, you know, it is a NEETPG examinations. It is very tough, particularly parts, top five, top six branches. If you are clinical, surgical branches, very difficult to get admissions. Part of it. Internationally, it is not. So we are going to discuss a lot of things which are there. You know, in India, the seats are very less, and number of students are very high. And that is why, despite many large number of students qualify, pressure is always on the premier branches. Seats go vacant into non-clinical branches or education related branches. There are many seats, so every year even NEET PG score, cutoffs will come down 50 percentile they start, and at the end of the day, it can go up to even as low as 0 percentile. May anybody can just walk in and take the admission. But those are the branches, as nothing much is the career, which is point of view, it is there. For academic, you want to become a teacher and all and teach the subjects. And mostly those are the branches are also, or the research branches, and which is a missing component in India, because we are very rarely doing any research into those non, but internationally those branches, even simple branch like the microbiology and all has a tremendous potential, because those are the branches are the research oriented, and a whole large number of PhDs are being created into that. I got many awards, Champions of Change Award, which is by Niti Aayog's award, very, very prestigious award. After Padma Award, this was very prestigious. The jury was former Chief Justice of Supreme Court of India, Justice KG Balkrishnan ji, and the big jury was there. Very prestigious award. Pride of Nation. It's when we won 1971 war, and in 14 days Pakistan was defeated and Bangladesh was created. 96,000 Pakistani soldiers surrendered. This was after World War II, biggest surrender in the world, and they celebrate Vijay Diwas on 16 December in New Delhi. You can see 1971 war heroes, General Bakshi, former air chief, and this all the three forces celebrate this as a Vijay Diwas. And at that time, Rajnath Singh ji was the chief guest, and I could really get award. I've been working very closely with the children of the defense forces, but getting any awards for defense forces is prestigious. Nitin Gadkari ji has given many awards. Maharashtra Gaurav is one of them. Corporate social responsibility. We have been working onto the CSR into the rural areas. Uttar Maharashtra, another from Devin Fadnavis ji. He has given almost 5 to 6 awards. This was along with me, Lata Mangeshkar ji, and ex-president Pratibha Tai Patil also got the award on the same day. Vinod Tavde ji, best career counselor, I got almost 35 awards. London, both houses of parliament, like we are Rajya Sabha, Lok Sabha, they have House of Lords and House of Commons. They have felicitated for 25 years in the service. And recently, Shushruta Award, which is after, Shushruta and Charak are the pioneers in medical in India, our ancient medical, Ayurveda and all, first surgeons also it is called. And after the Shushruta, government of India is awarded. Most of them were doctors. I was only non-medicos. I'm a PhD doctor. So, and it was very, very prestigious from getting Mansukh Mandviya ji, who was the health minister at that moment of time. So, a very, very prestigious award. Dr. Donald Martin heads my US team. He was a dean of Columbia. Columbia, is the Ivy League university, top 5 universities in the world. And he was 17, 18 years, was getting applications, admitting students. Even the University of Chicago, one University of Chicago has produced more than 100 Nobel Prize winners. Think of the strength of that particular institutions. And he's been training for almost like 43, 44 years. Basically, we have the big team. We have professors from Northwestern University to professor from Yale University, Indiana University, tenured, ex-tenured professors. We have big doctors team in United States, in New Jersey. So Astute is nothing but is organization of the academicians across the globe. We have brought to a single platform into that. Indian admission, already government college, private college, deemed university. Now, government college admissions are very, very tough in India for MDMS. 50% of the government seats, state government seats, central government, there are separate process like AIMS or JIPMAR or Armed Force Medical Colleges, Banaras Hindu University. There's a central government college, but the state government, every state has got a government colleges. 50% of the seats is given to the central government. So central government handles the 50% of the seats. Out of the balance 50%, which is with the state government, be it a Maharashtra government or Gujarat government, whichever government is that, 25% seats are reserved for the in-house. So somebody who's working in hospitals already, somebody completed the MBBS and working staff in a hospital gets 25% of the seats, and only 25% balance, which is given through the NEETPG counseling rounds. And in that 25%, again, there are quotas will apply: SC, ST, OBC, EWS quota, open category. So these seats are so divided, you will not find one seat, one college per branch also in many of the, most of the places you may find a zero seats actually. Pune has got a BJ Medical College, Ahmedabad has a BJ Medical. Go to the seat matrix. The per category, irrespective whether it's SC, ST or open category or OBC, whichever category is there, there are hardly any seats in government colleges, because 75% is gone and 25% is so much divided. effectively, very few seats are going to a particular person. And that is why now it is very important that we look at the international destination very carefully. One is about, as I said, the quality of education, because the researchers are sitting in the universities, in the hospitals. You get to work with the best of the doctors. And internationally, it is a cost effective. It is far lower than Indian cost, particularly if you compare with the private or deemed universities. Maybe slightly deemed universities are easier to get, but it is very costly. Not everybody can afford such a high level of education. Many students spend so much of amount in the MBBS itself, they are not left with the money for post graduation. In fact, PG requires more money than MBBS part of it. Whole you are doing 5.5 years of MBBS, post graduation, which is required more money. And international students, so those who have gone to different countries like China, Russia, Ukraine, Georgia, and all, when they come back, they cannot apply to the government colleges or private colleges. They can apply only to deemed university. And that is the biggest problem actually we are facing. The students cannot apply to government and private. So Maharashtra government has clear gazette notification. If you are coming from Russia, okay, you are cleared FMG exam or now the national exit exam, whatever exam you clear it, and you are completed internship, you are licensed practitioner, but PG you cannot fill the form of government and private colleges in Maharashtra. You can go to the deemed university, which is very costly. So it is a better to go to the international destinations after that. And as I say, National Medical Commission except US, UK, Australia, these are 5 premium countries in the world, English speaking country. Again, there is a always government of India is very clear, you should be doing your MBBS from the English speaking country. If you are going to non-English speaking country, your hospital experience is not there. Even though you in those countries you are done English medium education, students are struggling. We have seen the FMG pass percentage is so low. And now when the national exit exam will come, it will drastically drop, because national exit exam will be purely a clinical exam. And that is why you may find not even 5% of the students or 7% of the students will be passing the national exit exam. And that is going to be really a bad news for most of the students going internationally, non-English speaking countries. Always English speaking countries are preferred because of the hospital exposure. They are not going to ask the theory now, how the heart functions, how the kidney functions. They say if the patient is coming to you, can you diagnose the patient? And that is what is the major change from 2020. If you can diagnose a patient, you can treat a patient. So if the patient is coming to you with a stomach ache, it can be basic gases to cancer, anything. Can you diagnose and treat? And that is why clinical hospital exposure is a must. I have so much of students coming from Georgia, from Russia. They say, oh, language is so difficult. We don't have hospital exposure. I cannot talk to the patients. I cannot treat the patients. What level of doctors you are there if you are not going in a hospital? And that is what it is being tested now. India will introducing now it was announced, but due to election, it got postponed. But now anytime it should be coming. National exit one after 4.5 years of MBBS. It is going to be tough examination. And then if you pass, you do internship and then the national exit exam too. So either 25 this year also it can come, or 26 it is definitely going. This bill is already passed by the Rajya Sabha and Lok Sabha. President of India is signed. It is only a question when to implement. This is a law now. It has to come. There is no question of this not coming into. So now the 6 countries I talk about, national exit in India, USMLE, national exit, UK had a PLAB exam, which was scrapped by UKMLA, Australia. All these examinations now going to be 95% same. So previously what happens, USMLE was a different level, national exit or was in a NEETPG was a different level. Now the gap has been filling. Now all 6, National Medical Commission has signed 10 years of memorandum of understanding with World Federation of Medical Education. And World Federation of Medical Education is an umbrella body across the globe for medical education. So they have medical directory also. So any college under this will be accepted. And now once it is signed the ECFMG body, which I'll talk later, ECFMG pathway 3. Now all the medical colleges in India under National Medical Commission comes under the ECFMG pathway number 3. What does that mean? is you don't have to wait. You can have the continuous education part of it. And it's a big recognition for the Indian medical colleges now already. And this is going to be very, very critical. 24-25 was the most critical year. And now moving forward, the clinical skill, whole world is already restructured now in this year. Talking about the US, because US I always promote because US has a very structured way of admission. And it is a huge country. It is 3 times bigger than India. And it can accommodate actually all types of academic background students. So there are two programs actually. One is the residency. Everybody is aware of it. Most people know by the USMLE as such part. And second is basically a physician associate program. As per my knowledge, very, very rarely anybody in India has expertise to do that. We also have big expertise in United States. So this is the exam which doesn't require you. See, people misunderstood the American education system. People feel USMLE is mandatory to practice in United States. Absolutely not. USMLE is one of the pathway to enter into the medical, but it is not the sole pathway. If you are struggling with USMLE, doesn't mean you cannot practice the allopathy. You can be a surgical doctor. You can do orthopedic surgery in United States, even though you have not taken USMLE examination. So remove the myth from your the things USMLE. In fact, there are two additional licensing examinations. In fact, three additional licensing examination which will lead to allopathy practice in United States. It is not the so COMEX is another examination, PANSE is another examination. For nurse practitioner, it is a different examination. So there are various examinations which is possible. So what is physician associate? I'll take first a physician associate because this is going to be a game changer for all of us. And people are not aware of it. Just note down the website aapa.org. This is a government official website. Don't go to any forums which has got many misleading information. This is a government of United States official website. It has got each and every information about it. Physician associate is a university program. First thing, university program. Like in India, MD/MS is done in medical colleges. Whereas DNB program can be a small hospital also can be running DNB program. DNB program does not require medical colleges. And that is why recognition of DNB is always low. Internationally, it is very low. So normally I tell the student never ever do the DNB part of it. In India, it is okay. You grow ultimately after 15-20 years. Nobody asks in India. But you have to do the fellowships part. At the time, lot of restrictions are there. And that is why it is basically important that you do the MD/MS in India if you want to do it. Avoid it. If you have to take 1 year gap, it doesn't matter. So physician associate is similar to the MD/MS. It is in the premier medical colleges. So universities in India, there are 175 universities in United States which accept the Indian students or any student which is done from their medical education from China, Russia, Ukraine, Georgia, or any of the countries part of it. This is the program which is open to all biological science students also. What does this mean? You may be a Ayurveda student, you may be a homeopathy student, you may be a physiotherapy student, you may be nursing student. At a 12th standard, maybe you wanted to become allopathy doctor, you wanted to make a career in MBBS, you wanted, but you could not get maybe admission in MBBS, or sometime you were getting it, but you did not have money to really spend that much money for the MBBS in a private or deemed university. Now, this is the program, this is the time you can transfer, you can get additional degree of allopathy 24 to 36 months, 24-month basic branches, 36 months means 1 year additional for surgical or some clinical branches. 2 years to 3 years may a bridge program can give you the allopathy license to practice. So you know through therapies, you know the homeopathy or Ayurveda also, and you know the allopathy also. This is one of the best bridge programs ever. any biological science. It can be BSc biology, it can be biotechnology programs. So we have started many biotechnology programs in various medical colleges also, which is leading to the, so after 12 people go to the biological science, and then they come to the physician associate program. Currently there are 308 medical colleges. Out of that, as I said, 175 colleges accept Indian students, balance only US citizens. This is a master's degree code, 2000 hours of clinical rotation, very strong clinically. Clinically, say hospital experience is very critical. Even in like a MBBS program in United States, it is called Doctor of Medicine. And Doctor of Medicine had 2 years of internship. In India, we have 1 year of internship. In United States, it is a 2 years of internship. They believe unless you are in a hospital, you cannot become a great doctor. You have learned the theory in the classes, but now this is a time to implement and learn the diagnostic skills so that you can treat the patients. This program is very old program, started in 1967. Currently, as on last year, 2024, 178,000 doctors were there, and they are treating 500 million patients per year. Huge number of patients PS has been really treating. It requires a certification like USMLE. So USMLE problem is USMLE you are giving before you start your residency program. So it is a tough because it is based on Indian medical. But there is a PANSE exam. You complete a 2 to 3 years of physician associate, and then you give the licensing exam. First attempt, 96% students pass. Second attempt, 100% of the students. We have not seen even single student drop out in a licensing exam. So that means every student gets passed. Every student doesn't pass the USMLE exam and become resident. This is the program which is almost like a licensing exam passing percentage is 100. So that portion is gone. Just you have to get the admission into the PA program. And that is why it is created. All specialty. Surgical may around 28% people are surgical. Others means gynecology, to palliative care, to public health, dermatology, are others 26, 27. Primary care, internal medicine, emergency medicine, all types of hospital, urgent care, everywhere these people are working. All surgical may 28% are there. You can become orthopedic surgeon, you can become a neurosurgeon. There is no, you can do heart replacement surgeries after doing the PA program. Physician associate is very medical PG program. It leads you to the proper license in United States. So this is not an inferior program in any way to the residency program also. There are large number of American citizens over residency, they choose the physician. It is closer to the clinical part also. It is very strong clinical programs, and that is why many of the doctors are choosing sometimes if they have to given a choice. In India, we are only knowing the residency, USMLE, and that is why we never thought how great is this particular program. Three intakes are there, January, March. So 175 universities are divided into this once a year, the part of it. Very high salary, starting salary. Now, this is a last year's figure. This year, I was told 1,50,000 onwards, it is starting. Dollar is also appreciating. 1.5 crores per year. Think of a homeopathy doctor and Ayurveda doctor earning the 1 crore plus salary in the as a fresh person. And what is the living expenses if you maintain independent apartment in USA and you maintain a big car? You will not spend more than 25 lakhs rupees. You are getting 1 crore. You are spending 25 lakhs in a luxury lifestyle. You save 70 to 75 lakhs. What is the salary what you are getting here in India? Nowhere comparable financially this program. Medical doctors and lawyers are highest paid in United States. And there is a severe shortage of manpower. You go to the Google and just search what are the top 5 jobs available in United States. And physician associate, second or third, always second or third, one of the top trending job. You are in great demand actually. There is a severe shortage. You get H1B on platter, which is a lottery system for engineering and others. You might be listening currently. So much of hue and cry is happening over whether the H1B should be given, OPT should be given. Medicos has no tension on that. It is guaranteed H1B. Green card normally currently 3 to 4 years. You get a green card. It is leading to green card very fast. One of the fastest green cards ever possible is through the Medico route. Engineers may have waiting period of 70, 80 or 100 years. This is the program which will give you the really green card very, very fast. And it's a university program, as I said, very, very premium program. Only thing, you need to complete prerequisite. Prerequisite in India, we say eligibility. What word in India you say? I want to do MBBS. I should have done physics, chemistry, mathematics, biology, PCB, 11th and 12th. And in 12th, I should have got 50% marks. I am eligible. Maybe my admission is based on NEET exam, but to be eligible. So prerequisite is basically the subject you should be knowing, because you are doing the partial education, because this is a program where the biological science students also they are taking it. So what are those subjects? Is a basic subject: anatomy, physiology, biochemistry, organic chemistry, psychology, statistics, medical terminology. Now, these are the subject, or plain biology, basic biology subjects. These are you are supposed to take, and plus 250 to 2000 hours of clinical. What is the hospital rotation? So we help you to get all these prerequisites match. Prerequisites can be done in India. If you are in a first year, second year students, we can get connected to the American universities in online mode, and you can take the courses. If you have finished your course and you have, or maybe finishing the course now, you move to United States directly, and as an integrated mode, you do the PA program. That is the best way moving to the United States. But those who are in the first year, second year of MBBS also, or Ayurveda or homeopathy, physiotherapy, and wanting to go to United States, please connect to us immediately, because during the second year, third year itself, we will get this prerequisite from the American universities done. And that is the beauty of this particular program. We have many programs in India, which are the pre-medical programs, which are running into different university, like Parul University in Vadodara is already running one of the most premium pre-program. And now the MIT in Pune will be launching from this year these programs, where you can do the partial 4 years in India, 3 years into USA, and in 7 years after 12th, you are a practicing doctors. Very, very strong program. Prerequisites needs to be done. So these are the prerequisites. So anatomy, physiology, biochemistry, microbiology, chemistry, organic, most of the things which we do in any biological sciences. And what are the streams which are available to you? Specialties. Primary care में family medicine, internal medicine, pediatrics, cardiology, critical care, endocrinology, gastrology, all nephrology, neurology, you name the branches which are available. Emergency medicine, surgical may think of the surgical, cardiovascular, barbaric, colon, general surgery, neurosurgery, oncology surgery, orthopedic surgery, pediatric, plastic surgery, thoracic surgery, transplant surgery. All surgical branches are available under this program. Special addictive medicine, allergy, anesthesia, dermatology, genetics, hospital, nuclear medicine, gynecology, occupational, ophthalmology, pain management, pathology. You name the specialty and the PAs can do. That is a great program. That is what I am saying. It is a really a great program. Just go to United States in 4 to 5 years integrated program. So 2 to 3 years is your PA program, and to do the prerequisite 1 to 2 years. So you do the prerequisites in United States, it will become a standard program. Many times, many students struggle in online mode, because if they have not that strong academic background, because the way Americans deal and way the Indian institutions deal, even the anatomy subject taught in Ayurveda or homeopathy college or MBBS colleges differ in the strength. And that is why many times I prefer it. This is the best way to that. And your credits, we will transfer those credits, your Ayurveda credit, homeopathy credit, your physiotherapy or BSc biology or BSc microbiology, the veterinary science, you name the course actually, or even MBBS, these credits will be transferred. So maximum MBBS students are going to physician associate program today. But we want other stream students also to come forward, because there is a lack of awareness. People are not knowing such program exists, because whole of India, I do not know anybody else is doing this program. It's a very complex mapping program, and that is why this is the most preferred option for you. You go 4 to 5 years into the United. 12th standard students can have, there is a recently really fantastic program. 6 years you are practicing doctor, including post graduation. After 12th, in 6 years, you are a practicing doctor in a specific specialty, not MBBS, not MBBS, but MDMS level in 6 years after the 12th. One of the best programs it is possible in United States, and you practice into the United States in 6 years. One of the fastest program in the world, actually, including if you include post. In India, 5.5 years of MBBS, 3 years of PG, 8.5 years. Plus, there is a 1 year gap for the NEETPG and everything. So 9.5 years or 10 years it takes actually. And then you do the DM part of it, another 1 to 2 years. So 10 to 12 years in India, as compared to half the time you are practicing doctor, you get to go to H1B, you got a green card, you get a immigration, and you are a citizen of United States in a fastest mode possible. After 12th itself, if you are in the first year, second year, you leave it and move it to US. I told many homeopathy students were studying in second year. I say, okay, you are done 2 years, go fly to United States for now. Don't complete even the course here in India. Okay, you there is no need to course complete whole for homeopathy and then you go. You move now itself, whichever stage you may be there in life. You may be doing the BSc in the second year, move it next year. If you may be a microbiology student studying it, you may be dental student. There's so many dental students are also going to the allopathy because they wanted to become an allopathy practitioner. Do not wait. Just move. Government of India is very particular. Just move to the international. Only some problem is there for MBBS because MBBS, they are not releasing many students or they are demanding some additional fees and all. But if you are in a government hospital and all, then you can definitely move. Private and team mein thoda sa we have to pay some money. But even if you, it's worth paying some of the money, settle it out and move to that. Government of India in National Medical Commission is coming out shortly, the regulations. You can move from the medical colleges also. Very, very standard programs, very, very powerful program. Second is the residency. We are experts in residency. As I say, we have affiliated residency hospital. We know residency, you get $5,000 to $10,000 per month as a stipend. In a physician associate, you can work part-time and earn the living expenses. Here, the residency program, they are paying you the living expenses. You can maintain, as I say, car and independent apartment into that. And now the USMLE exam has been truncated, and it has got only 15 to 20% way. But previously it was 80%. You have to crack this exam. Now this is a US medical licensing. It is not an admission exam. Just remove from your mind that USMLE is an admissions exam. USMLE is not admission. It is a US medical licensing exam. You should have minimum standards. If you go to the statistics of USMLE, more than 92, sometimes 92, 93% student pass in first attempt. Any exam where the 92 to 93% pass in first attempt is never a too difficult exam. Even 12th standard people, 94, 95% student pass. NEETPG 50 percentile, half the students are not qualified. Even at the borderline, you pass it also, you don't get a good college or branch. Here, now, you have the opportunity to go to every branch into. But only peculiarity about this exam, there is no improvement. NEETPG, you get less marks, next year repeat. This you cannot once you're done 7 years, and that is why you need consultants like us. You need really career counselors like us who knows when to give the exam, what has to be the strategies has to be made. USMLE based or residency admission is not a straightforward admissions. Many brilliant people, brilliant, academically brilliant people don't get residency, and average students get residency. It is all about the strategies. Residency is all about the strategies. Residency is not about 100% about your thing. And now the parameters are completely changed for from 2023. 2024 was the first batch, and 2025 just recently in the March we concluded the residency admission. We know what parameters now the admissions are at. So USMLE step one is become pass and fail. So what is step one? Pathology, physiology, biochemistry. Patient symptoms they will give. It's all clinical. No theory questions. Step one does not have theory questions. Don't attempt to take in second year, third year. Please do not take it. Minimum 6 months of internship is mandatory to take the step one now. If you try to take when your syllabus is not complete, it is not theory. You will give the patient symptoms, they will give pathology reports, four option, diagnose. And step 2 CK, 60% internal medicine, what we call MD medicine here, 10% gynecology, 10% surgical, 10% pediatrics and psychiatry. Very well structured exam. Again, you will give the patient symptoms along with pathology. They may give MRI report or any of the sonography report and all. Four option, diagnose. It is more holistic. Step 2 CK. 65% of the syllabus overlaps step 1 and step 2. And that is why both preparation has to be done simultaneously. It is not after the step 1. You have to do the step 2. And these examinations mostly happen every week. Whenever you are ready, you have to give, because 6 years you cannot really, 7 years you cannot repeat this exam. If you get less than 250 marks in the step 2 CK, step 1 is pass and fail. You don't know what is marks you are getting it. Step 2 CK, with a new regulation, new admission processes, you need to take the step 3 exam. If you get less than 250 marks in the step 2 CK, if you get more than 250 marks in the step 2 CK, you have very high chances of getting admission. These are the notional cutoffs. It is not published anywhere. This is, we are talking about based on our past experience, this year's data, we check it. There are few students with 240 also got admission, but then their other profiles were very, very strong, which I'll talk later. Because USMLE is 15 to 20% weightage. So you are 80%, still you have scope in case you have got less marks. But problem with the admission is many times for the interview purpose, they will look at USMLE. They will not go through the too much detail in your profile at the initial stage at the college. And many times we have seen the student was brilliant. He has done a gate, but he could not get interview calls because his USMLE score was low. So at that time, always we have the backup system of step 3, or we can go to the physician associate program. Definitely physician associate option is always open, even if you are going for the residency part of. So USMLE is only now the minimum. It is not very high marks of USMLE and you get admissions. What is important is 80 to 85 research projects. Very critical. Now, very straight process of application, ERAS, which is the electronic residency admission process. It has required 10 experiences. 10 experiences. Out of that, 3 has to be substantial. It may be voluntary experience, it may be teaching experience, it may be doing any of the research projects, smaller research projects, it may be doing creating the awareness in the market. There are so many things what we are doing. Research projects are also peer-reviewed research projects, the publications part of it. There are articles which are there are poster presentations are there are oral presentations are there. We get it. It's a very well structured, almost like 52 parameters they evaluate you, part of it. Hospital rotations in United States, we are the experts in hospital rotation. Any branch, we can get you hospital rotations in United States. You want surgical branch rotation, you want gynecology rotation, you want, we have connected with 450 hospitals in United States. So we have our own set of hospitals. We have our 2 partners with us who are the big chains of hospitals. So we coordinate with each other based on when you are to fly and what are the things are there. So hospital rotations is least. And when you go to the premier hospitals or premier doctors under which you work, you get a letter of recommendation. Letter of recommendation is given by doctor, not by hospital. And today, letter of recommendations is very critical. There is a big hospital, Hinduja Hospital in Mumbai. Okay, and junior most doctor in that hospital is giving you a letter of recommendation as no value. But there may be a small clinic in Pune and the doctor is 30 years of experience doctor. His letter of, because he is a 30 years of experience, his letter of recommendation has more value. Maybe he is running. So there are so many, the OPD clinics are there in United States. That is for internal medicine, it is most critical is the patient interaction. Sometimes when the patient is admitted in-house in a hospital, you don't get really exposure. Diagnostic exposure I'm talking about. When the patient is admitted in a hospital in a ICU or anything, most of the time the diagnostic state is done and it is a treatment which is going on. Whereas in a OPD setup, the patient is walking in with the disease and then doctor is diagnosing, and that experience is mandatory. So internal medicine 2 months is mandatory. Then additionally, you do the surgical or in-house, you go to the hospital inbound, absolutely, inpatient, what they call it. outpatient is mandatory part of it. Then the comes is you created a profile, you are done. So I have professors in the Yale University, Indiana University. They will speak one to one and we get a research projects done from it. We have doctors team here in India which will get a research projects done from. So research, one or two big research projects, publishable level, and small projects. It's a quality and quantity both which are important. And when I say research, it does not mean you are inventing something. Maybe somebody else has published the research paper and I'm evaluating that research paper. I may be doing research on environmental aspect. I may be traffic management master. It is not necessarily only medical research. People misunderstood the research as only the medical and they try to copy here and there. That is not required. Program selection, where to apply. Does everybody applies to AIMS will get AIMS admission in India? You are studying in various medical colleges in India or international. You get admission based on your profile. If you somebody gets AIMS New Delhi because his profile was good, another maybe get BJ medical profile. Somebody may go to private college, somebody may go to deemed university. If I apply only to AIMS, will all so people blindly applied. New York may is a grade, New Jersey grade, California grade. They have pile up of applications, and you don't get really admissions because they are pile up. And there are other states which are basically are vacant. Where to apply? You cannot apply to large number. There are 40,000 seats in residency in United States. 42,000 students apply. But for international student, it is only 12,000 seats are there. So out of 40,000, only 12,000 is there for Indian students or international student, not only Indian, international students. Those who have done medical education outside of United States and Canada. Now that 12,000 also American citizens are fighting with you. This year, almost 6,800 or close to 7,000 students get admitted into the residency part of where to apply most critical. You cannot apply to even 7,000 places or 12,000 places. You have to pay lakhs and lakhs of application fee. You apply to 100, 200, 300, or anybody has got money may go to a very weak profile is go to 500. Nobody goes more than 500. Big amount of money is required. Every application costs money. You have to have robust documentation, your MSP report, your letter of recommendations, your resume part. Resume is not to be attached. Now that era is gone, CV building. People used to come, oh, CV building. CV is not required now. I don't know which era these people are there. They don't know anything about the residency. If somebody is talking about CV is not required. It is a 10 experiences which is critical now. The whole admission system is changed now. New parameters has come. It is a very well set parameters. You might have done 15 things. They don't require. They require 10 means you have to give the 10. They say 3 meaningful experiences. It is continuous. You have to give 3. You cannot give 4, even if you are done. Now CV building has completely changed this perspective. No resume or CV has to be attached in the application anywhere. Nothing is required. It's all changed now, the admission process. IRA's application is completely revamped. There are signaling which has come now, which we call in India is the basically preferences. I'm giving commitment to the hospital. What signaling is, I admire this hospital, my dream maybe. In India, we say dream college or dream university or dream program. Lot of things are there. So if I am a college, I get 500 application, I will call only 100 students for the interview. And that is based on this profile building. So your 10 experiences and all the research and all will determine whether you get an interview calls or no. If you fulfill those requirements, and if you are a student, you get 10, 15, 20 interviews, you will rank the universities and both are matched. That is why it is called match process. In India, it is a merit-based admission, rank. NEETPG you give, you prepare a rank and based on rank. United States, it is not ranks. It is a chances of admission. In India, I can still fail the BJ medical even with a NEETPG, very low score of NEETPG. I can still fail BJ medical college because it was based on the merit list. In United States, I cannot fill the top college if I unless I'm sure I'm getting admission into that. So chances of admission based on 52 parameters, very complex. Very rarely students complete all 52 parameters. Normally it has 40 parameters. So you have to start from first year of MBBS now. You have to build now 80 to 85% is your non-academic and academic, both the projects has to be done. You have to start first year, second year of MBBS. So the 4 years you build this profile. Earlier, Till 2023, it was USMLE, USMLE, USMLE. You give the good marks in USMLE, you admitted, otherwise no. That has gone now. CV building was 20% of the things. There was CV building and all they were used to talk. Now it is the whole new paradigm, whole new process. And that is why this match process, the who is designed, he got Nobel Prize. Think of the how complex is the logic. Student doesn't understand these logics. We have the expert team, as I say. We ourselves are admitting the student. We know in and out criteria and supplementary soap rounds. In a day, 4 rounds. Very complex. Again, we call in India second round, third round, fourth round. In a 1 day, 4 round, 45 colleges I can select. And that is going to be very 5% success ratio in soap. Very complex admission process in soap. There are very less past 5% success ratio. But you can get it into that. So overall, you have to prepare the profile. So USML is one part, profile building is part, rotations is there, letter of recommendation, documentation, program selection, IRAS application, and residency interview. We prepare you for the residency interviews. How to give, what to speak. It's a psychological. You have to improve the English. If you feel your English is not polished, we have to polish the English, match and so end to end everything. Three months. I will evaluate your profile. 3 months academic, non-academic, what has to be done, we will schedule it. Every month we monitor you. Every month we have the meeting either with American team, we have the Indian team, we have doctors team. We constantly meet and monitor it. So from first year itself, a second semester of first year, we start this process. You may be sitting in Russia, China, Ukraine, Georgia, you can connect because this is an online program. It's a one-to-one program. It is not a group program, 5 people, 10 people. No, my US faculty will speak one-to-one with you and get a research projects done. That is why the success is of this program. Otherwise, in a class, 50 students are sitting, teacher come, teaches, how many person? No, it's a personal monitoring program. We monitor the progress of each and every student. We handhold each and every student. We understand the strength and weaknesses of every student. And we handhold till the residency program or physician associate program or any other programs which are. That is, we are career counselors. That's what we call it as a career counselor. So we are team in India, we are team in United States, we have affiliated residency hospital, we have 450 hospitals in United States for rotations part, clinical rotation part, everything in the single umbrella. Only thing what we don't do is the USMLE training. And that is why we say Kaplan is the best. Kaplan, world, there is no match. In India, there is no coaching class for USMLE. Kaplan is best. You can take online lectures or you can physically go to their New York center. There are people who are struggling with USMLE and they don't want to do anything other than residency. They fly down. We will arrange them the visa, almost like a 2 years visa, because it may take around 13 to 14 months to clear step 1 and step 2 CK. And you are sitting in a center where the faculty is there. USMLE faculty is sitting next to you. You can ask your queries and everything in a New York center. It costs money because you have to stay in New York City, but around $10,000, 7-8 lakhs rupees. The tuition fee is not very, very high. Their tuition fees is low, but you may have to spend some money in the living expenses in a New York City. You can stay in New Jersey and do the up and down through the metros and all. But that is one of the best things which is possible in terms of that. These are official website. Take a screenshot of this. NRMP is the admission site residency. It has got all the data. If somebody says you don't get a surgical clinical branches in USA, prove with the data. Indians, there are currently out of all practicing doctor in United States, 30% are Indians and large number are doing surgical and clinical in residency. PA is the best for surgical. I feel residency, you can get it, but you need to have very good profile in residency. But if you are sure, I want to become orthopedic surgeon, don't touch the residency. Go to the physician associate, particularly surgical branches. Okay, it is a PA program we should you prefer over the residency. Both are equally same program. I don't find much of the difference in long term, nothing. Slight difference in the starting salary, it doesn't matter. ECFMG is the body which will validate your degree. That is what ECFMG registration can be done after second year of MBBS. Residency, only MBBS students can go. Ayurveda, homeopathy students cannot apply to residency. Whereas physician associate, even MBBS and other students can apply. That's it. USMLE is the basically your USMLE.org, USMLE paper, NBME paper setter, mock test. You have to take a mock test because once you give 7 years, you cannot really repeat it. National Medical Commission website in India, which constantly gives the regulation, and American Association of Physician Associates, AAPA dot for physician associate. Refer only this site. You will get 100%. Even in physician, so which college, names of the university, where Indian student, what is the fees, what is the prerequisite subjects, every information is given into this. Surgical and clinical are possible. They are getting students. I'll show you this data. This is not for American citizens. This is for the international students. This data is published on this. All the branches, blue is admitted student, green is rejected student. You can see low marks में blue, you can see many branches, even gynecology, surgical. These are the international students who are admitted. So if somebody says, oh, surgical or clinical not possible, show them this site, which is already on the website of the nrmp.org. This is the source is NRMP. All branches, think of child neurology, dermatology, gynecology, general surgery, pediatrics, neurosurgery, gynecology, orthopedic surgery, pathology, pediatrics, plastic surgery, radiation oncology, vascular surgery, some are listed. Some more branches. These are one of the things. And you can see sometime green is rejected. Very high marks in green, still the student is rejected. Very high marks in USMLE, still the student is rejected. And you are lesser mark in USMLE, and still the student is admitted. So USMLE is one of the parameter, not the sole parameter. And without USMLE, if you want to do, is the physician associate program. So USMLE never ever give unless you are 6 months in. You can take any time after second year. That's not a problem. And CK, it is 250 plus I want. You finish 12 months of internship, go to 3 months in United States, and after that, how the Indian doctors diagnose and how the American doctors diagnose are their difference. Take this. You do not break your internships. Many people mislead the students. Okay, you have to keep 1 or 2 months of internship. Other you don't get the clerkship or something. You cannot touch the patient. It's absolutely wrong. Somebody who is in the internship can touch the patient, and somebody who is passed out 3 years back, completed a MBBS practicing in a hospital cannot touch the patient. What is the logic? Logic is very clear. If you are step one cleared USMLE, you can touch the patient, but ultimately it depends on the hospitals or the doctors under which, because they are in medical negligence. I will give, I have 450 hospitals with me. You complete your MBBS part of it, complete 3 months of rotations in United States. I will get it. Absolutely, after completing the full internship. So if February, March, you finish your internship, April, May, March, April, May, June, you go fly to USMLE. September is the application process. Every year, September. You apply in September. By October to January, you give the interviews. And then March is the admission, and June, July is the admission. Very structured process. When you come, we are very planned. We evaluate your profile. We will give proper guidance into that, everything part of it. Start from first year, MBBS, BMS, BHMS, biological science, any stream. Start early, build a profile. That is important. Even physician associate require building a profile. And it is, that's what we call is the mentoring program, international mentoring program. We run a proper, what is the American university requirement? What is your level? Can we bridge that gap? That is a mentoring part. These are my contact details. You can call up, you can go to astuteacademy.com. You can book one-to-one appointment, either on Zoom or in person. So we have office in Mumbai at Dadar. We have the office next to the Dadar station. In Pune on Ferguson College Road. We have opened a new office in Ahmedabad now, Ahmedabad and Vadodara in the Parul University. We have tied up with the Parul University and we are running pre-medical and all programs there. So Parul Medical College campus, we have the proper room. And Ahmedabad. Ahmedabad is our big office now, which is come up, and if any of the questions are there, I'll be very, very happy to take the questions part of it. So think of medical PG in India is not difficult, but very costly. You need to get very high marks in NEETPG, which sometimes is not possible. And when national exit come, it will put more pressure. And US, UK, Australia, New Zealand, Canada. These are the country. US I always prefer. But if you want to go to UK, Australia, New Zealand, we also do the UK, Australia, New Zealand. You have to first get a licensing exam passed. like UKMLA in the UK, Australian Medical Commission in the AMC exam. Into Canada currently requires a residency. So Canada we are not touching. And then you do 1 year internship, you get a license. These countries interview based selection. So you apply to the medical colleges for the post graduation. They will go through your profile. So your profile building, you have no choice. Any country you want to go, you have to build a profile. They will not call you for the interview in even UK. And then you give the interview, and interview based selection very difficult. US has very structured program. US interview is a psychological interview. It is not a medical knowledge they are going to ask any question. Medical knowledge is tested by your MBBS score, your USMLE and other things. They are not the, so American interviews are psychological. Whereas UK, it is a neurology. You are going, you will be taken neurology, and it's very difficult. Many times 2 3 years just pass in the interviews, keep on giving. One day you get it, and then you start your post graduation. Where by that time you are already completed your post graduate. When you are starting in UK and Australia your post graduation, at that time you are finishing your post graduation in United States. So why to waste so much of time? And then when you take the American degree, you go to Australia and settle down. Nobody is stopping you to go to Australia. You can go to New Zealand and you can work in the New Zealand. That's not a problem at all. So think of that particular portion also. These 5 countries, US, UK, Australia, New Zealand, Canada, has an indirect acceptance. But if you want to settle down, it is always American or Australia. Is both the countries are great countries. So thank you very much for joining in large number. And I will close the session now. But my continuous sessions are there. astutepromo.com. It is my YouTube channel. You can see the same recording on astutepromo.com. You can go and visit it. And please think on medical PG. Even if you have academically not very strong, your percentage is low, but you have zeal to work. Hard work has no solution. You still needs to be done, but not everybody is able to crack USMLE. Please understand, it is a difficult examination to crack, and that is why it is great to have the integrated PA, which is best way forward to get into the surgical and clinical. So we need to really important which branches also specialization looking. Sometimes we say don't go to residency, go to the PA. Thank you very much and appreciate in joining in.